Cholesterol is a waxy fat-like substance that is found in all the cells in our body. Our body needs total cholesterol to make hormones, vitamin D and substances that help us digest foods. Our body makes all the cholesterol it needs. Cholesterol is also found in foods from animal sources, such as egg yolks, meat, and cheese. Hypercholesterolemia is the condition of excess cholesterol in the blood. If we have too much cholesterol, that is hyperlipidemia in our body, it can combine with other substances in the blood to form plaque. Plaque sticks to the walls of our arteries, which builds up plaque known as atherosclerosis. This can lead to coronary artery diseases where our coronary arteries become narrow or causes chest pain, angina, shortness of breath, even chances of heart attack. During chest pain, you may feel pressure or tightness in your chest, as if someone were standing on your chest. If your heart cannot pump enough blood to meet your body's needs, you may develop shortness of breath or extreme fatigue with activity. A completely blocked coronary artery will cause a heart attack. The classic signs and symptoms of a heart attack includes crushing pressure in your chest and pain in your shoulder or arms, sometimes with shortness of breath and sweating. A lipoprotein is a biochemical assembly whose primary function is to transport hydrophobic lipid fat-like molecules in water, as in blood plasma or other extracellular fluids. High-density lipoprotein, low-density lipoprotein, and very low-density lipoprotein are some of the types of lipoproteins. They are the combination of fat and protein. The lipids need to be attached to the proteins so they can move through the blood. Different types of lipoproteins have different purposes. High-density lipoprotein is sometimes called good cholesterol because it carries cholesterol from other parts of your body back to your liver. Your liver then removes the cholesterol from your body. Low-density lipoprotein is also called bad cholesterol because high LDL level leads to the buildup of plaque in your arteries. Very low-density lipoprotein, also called VLDL, is bad cholesterol as it too contributes to the buildup of plaque in your arteries. But VLDL and LDL are different. VLDL mainly carries triglycerides and LDL mainly carries cholesterol. There are a variety of things that can raise your risk for high cholesterol. Age is one of the factors where your cholesterol level tends to raise as you get older. Even though it is less common, younger people, including children and teens, can also have high cholesterol. High blood cholesterol can run in families as well, known as heredity. Likewise, being overweight or having obesity raises your cholesterol levels. Also, certain races may have an increased risk of high cholesterol. African Americans typically have higher HDL and LDL cholesterol levels than whites. The most common causes of high cholesterol is an unhealthy lifestyle. This can include unhealthy eating habits, such as eating lots of bad fats. One type, saturated fat, is found in some meats, dairy products, chocolate, baked goods, and deep-fried and processed foods. Another type, trans fat, is in some fried and processed foods. Eating these fats can raise your LDL bad cholesterol. Lack of physical activity with lots of sitting and little exercise. This lowers your HDL good cholesterol. Smoking, which lowers HDL cholesterol, especially in women. It also raises your LDL cholesterol. Often, genetics may also cause people to have high cholesterol. For example, familial hypercholesterolemia is an inherited form of high cholesterol. Other medical conditions and certain medicines may also cause high cholesterol. The physical symptoms of familial hypercholesterolemia are xanthomas, meaning fatty skin deposits, xanthelasmus, meaning cholesterol deposits in the eyelids, and angina or chest pain. Cholesterol is measured in terms of milligram per deciliter or millimole per liter. If the total cholesterol range is below 200 mg per deciliter, then it is considered as optimal level. 200 to 239 range is the intermediate span, whereas greater than 239 is high and considered dangerous. Range in terms of millimole per liter is shown in the table respectively. Similarly, the ranges for LDL cholesterol, HDL cholesterol and triglycerides are given in the table respectively. The patient must act accordingly to their respective cholesterol range as directed by the physician, on the basis of cause, pathogenesis, symptoms defined as kapha and meta imbalance. When metadatu becomes passive, channel of fat tissue becomes toxic and excessive metadatu get deposited, obstructing flow of various body fluid. The imbalance of kapha dosha causes hypercholesterolemia in the blood and shows the sign and symptoms of abnormal heart rate, chest pain and so on. Lipzen Capsule is a natural cure medicine which contains important herbs such as Shilajit, Arjuna, Guduchi, Guduchi, Yastimandu and others with anti-arthritic, anti-atherogenic, anti-platelet, anti-hyperlipidemic, and anti-choleretics properties that balance the kapha doshas, with no risk of side effects, and works directly on the cause of ailments to eliminate them from our body. It helps in the repair and regeneration of defective cells as well as maintaining the metabolism of carbohydrates, proteins, fats, and free fatty acids, and removes the plaque formation in the coronary arteries and promotes the proper functioning of the heart rat, as well as relief of shortness of breath and chest pain. Lipzen, presented by Deca Herbals, contains different Ayurvedic herbs such as Shilajit, Agnimantha, Lasun, Arjuna, Guduchi, Mulak, beej, Yastimandu and Guduchi. It is taken 1 to 2 capsules thrice a day or as per the physician. The capsules are taken orally, and in terms of large dosage intakes may cause stomach upsets, diarrhea, vomiting, drowsiness and sedation. Lipzen capsules can be administered with medical supervisions only. In order for the capsules to work effectively, patients should be cautious about avoid eating fatty foods, cheese, processed foods, high-fat milk, yogurt. Patient also has to minimize the consumption of sweets and cold foods and drinks. The capsules must be stored in airtight container after use, away from direct sunlight.